My name is Alina Williams, and I'm the program manager for the Western Canadian Children's Heart Network. We are an interprovincial program that is housed and operated out of AHS in service to the 5 pediatric cardiac surgical centers, centers in Western Canada. And our program serves to coordinate and facilitate pediatric cardiac surgeries across all of Western Canada.
Awesome. Thank you, Alina. I'll click the right screen and move this forward. All right, okay. I still remember the very first time we spoke, Alina. I was inspired by the conversation, like just how passionate you are about what you do at AHS and the impact that it has had. Again, thank you for taking the time, and I'll kind of review. I'll try to do justice in reviewing the day in the life of a program manager. So the ability to identify trends and access to data and respond to clinical inquiries in a timely manner, I think that was key. Being able to connect across the 15 cross-functional teams, especially because of how WCCHN is laid out, and then being able to protect patient privacy across those provinces, I think was kind of the key things that you had mentioned in your day-to-day. And to the right, you can see it's 4 provinces and 5 children's hospitals and 1 heartbeat. And you talked about how access across those 4 provinces is key, while making sure everybody gets the same kind of service and has access to it. Some of the key KPIs that you had mentioned were, the surgical centers minimizing abdominal bumping their ORs, and being able to understand backlogs and wait lists and reasons for surgeries held. So some of the key KPIs. So these are the key things to keep in mind as we think about your day-to-day, is kind of what we took from our conversation. With that, I'll kind of go to the next slide. So this is where this lays out WCCHN's history. And I would love for you to walk us through, because I think who better than you to walk us through the entire timeline here.
Sure, absolutely. So one of the things this program was tasked with 20 years ago was developing a system to be able to electronically refer patients across provincial borders in a private and secure, technically secure way. And so we are constantly moving patients across sites and working with teams to figure out how can that transfer of information be seamless when a child lives in Manitoba, is sent to Vancouver for surgery, and then transferred back to Manitoba for their post-op and recovery. We were also tasked with benchmarking our clinical outcomes to prove that the solutions the ministries of health thought would work in terms of improving child mortality in Western Canada, to prove that they actually were working. So over the last 15 years, we have been collecting and expanding our data sets as a natural byproduct of this process. We were getting all sorts of data on administrative data, where people are traveling from, where they're going to, how long it's taking them to get their surgeries, what these outcomes are. When I came into the position in 2018-19, I realized, I love to tell my Tableau story, I realized that our data was trapped in the system, and we didn't have the skill set on our team to really be able to leverage the power of the story. And of course, we could answer questions ad hoc, build a query, spit out some output, but tables and spreadsheets fall really flat. And this was a de-identified way that we were able to really bring that data to life, drill down into outliers or trends, let that inform some of the clinical decision making. We've been able to isolate areas where we look at things and think, well, this looks a little bit funky. Maybe we need to target some strategies around that. And so really, we did a quick sort of look into what are all of our options to call in backup. We need to solicit some expert help here about how to untrap our data. And there were lots of options available to us, but of all of them, Tableau, and specifically AHS's partnership with Tableau, really rose to the top above all of our other options available to us, and has delivered tenfold, more than we ever imagined it would.
Awesome, thank you. That's always, I feel like the transition before and after Tableau, and also like the themes, right? The siloed data and the case by case of data exploration, and the transition as to how you now are able to look at it holistically, the end to end. That gives a good like highlight of like where you can be using Tableau.
Absolutely. And the information and the data has always been there, but the trouble is, one, someone had to ask for it to
Yeah,
get it, and two, they had to know that it was there to be able to
yeah,
ask for it. Whereas Tableau um, bridges both of those gaps so nicely.
agreed. Well put. All right, I keep moving the wrong mouse, but all right, next one. So here I wanted to kind of summarize again, what we talked about, right? The value that the current state you're able to get out of using Tableau at WCCHN is the clinical staff being able to identify, trends of why there are surgical cancellations happening during RSV season, which can be very critical and important as they're understanding wait lists and all that kind of information. So also answering clinical questions like how many people living in BC border are able to receive surgery in Alberta. That is the interpretation, just being able to understand all that data in a secure manner and being able to answer those clinical questions, I'm sure is a huge plus, and you're getting the value in your current state. And future state, we kind of talked about offering that centralized access to benchmarking data, so kind of increasing that, exploring Tableau further out, and starting to do that with the benchmarking data, developing a user base with the right permissions, so kind of getting further into access and security, advertising and expanding clinical use cases, identifying quantifying impact and like waitlist improvement and surgical cancellations, understanding, outliers that help with targeted intervention for a future state by providing insights with strategic ways to address it. And then the organic quality assurance, making sure a program or a initiative is actually working or not, using data to back that assurance up. To the right, you'll see, I think this is something that we have been highlighting throughout the conversation, and everybody's kind of pointed that out. Just being able to access data and use data in a format that is visually understandable. It's easy to comprehend, and not needing, specific resources. No scripts are needed. And then one central place to access data, and being able to interact with patients and family, physicians and clinicians, hospital and government administrators, in your case, Alina here, just being able to do that with that one platform, one tool, and handle ad hoc requests and quickly respond with data. So that's definitely the picture of current state and future state that WCCHN has for Tableau. Anything else, Alina, that you'd like to highlight here? I tried to do justice, but if there's anything that I missed, please do let me know.
No, I think you did great. And I would just add that in current state, we are also before, where we would have had to, be approached with a question, build a query, write a script to get the output. Now people are calling me up, even at the government or ministry level. Hey, Lena, what about this? Can you give us an idea of, what is the distribution of referrals across all 5 referring centers? Where is the concentration of the surgical activity happening? Are we doing our surgeries when we say we're going to do them? Can we demonstrate that truly there is no disadvantage to a child based on residential address, that all children are having equal access to these specialized service regardless of the province they live in? We're also, like you mentioned, looking at what are the reasons that our surgeries are being canceled or held. If they're being held, how long are they held for? How much notice are clinical teams and then families being given before these cancellations? This is all information available on a single in a single workbook, whereas you can tell how many questions people would have had to have approached us with to get that information out, whereas now we're just volunteering it to them. So it really is game changing. In terms of future state, Jason Scarlett has kindly lent us one of his analysts. We've been working with Pierre, who's on the line today, I believe, to take this to the next level. And so rather than just looking at the administrative data, we're actually starting to give clinicians that clinical data as well. And so both current state and future state are just very exciting, knocking it out of the park for sure.
Always great to hear that. And leads perfectly into the quote that you had that we wanted to talk about, like taking the power of information from our hands and putting it in the hands of people who are better positioned and capable of actioning change.
Oh, I love
Um,
it.
yeah. When you said that, it was immediately like this was the code that this was going to go there. And any example that you'd like to highlight for this specifically?
Yeah, for me, I think that being able to action insight from our data is as a result of this partnership with AHS and Tableau is huge. But I'm going to say that the number one benefit that we've walked away with is that it has re-energized people about what is possible, what we have, what can be done, where we are, where we're going. It is a phenomenal conversation starter, and this is just only the beginning. So I am eternally grateful to the team over there at AHS and Tableau.
All right, thank you. And this is the one slider that would, I think, nicely summarize where WCCHN has started. We started with like you talked about the concern in child mortality, and here now is where database decisions are being made using Tableau. We'll not try to walk through each and every line item over here because that might take forever. But the day-to-day, what it looked like before, where you had data, like you had mentioned, Alina, data was available. It was just that it was only to people who requested for it or asked for it, and more in a siloed format. Whereas using Tableau, it's easily accessible. Data points across functional teams are shared and are real time. And you're then able to pilot across other use cases, be clinical or the way where you started with like the family satisfaction post surgery, and then you're able to present those KPIs to the board as well. So kind of like extending that the data that you already have and making it available and accessible, so you're able to find out trends and go from there. And I think what I'd like to highlight, I think we talked about the pain points and successes as well. I think the biggest pain point, or I shouldn't even say pain point, right? The biggest gap that existed was the awareness of data. You were collecting, awesome data and information that would really help, but the awareness was kind of where the gap existed. And I'll have you talk to what that win looked like after using Tableau.
Yeah. So I would say that our team is the one collecting the data. Our team houses the data, but we are not actually the ones benefiting from the data. We're the only ones who could see it or knew about it, could access it. And so it goes right back to that quote from the slide before about this has empowered us in a way to be able to take a group of people who are not data scientists, we don't have data or technology backgrounds, and to be able to give us this ability to give patients and family and clinical teams the information they need to be able to action change is invaluable. And we are very quick to say in WCCHN that the heroes of our network are not us in the administrative office, but those clinicians as well. And so I think that we were doing everybody a great disservice beforehand, and Tableau and AHS were able to help us kind of turn that around.